Good afternoon, everybody. My name is John Lopez. I'm the project director for the MAT Waiver Training Initiative for PAEA. This webinar is to introduce the training initiative and the resources available to support your program in implementing the waiver training into your curriculum. The webinar is being recorded, and an archived version will be available for view at a later date. A message will be sent out when the recording will be available. For those of you who want to follow along on the PowerPoint or want to copy the PowerPoint for your records, at the bottom should be a tab marked handout, and you can go ahead and download a PDF of the or PowerPoint presentation for today. So we're going to discuss a little bit about how we got here with the MAT initiative. We'll talk about the training resources that are available for you and your students, along with a host of other resources available through various venues for opioid use, mental health, and treatment of use disorders. And then at the end, we will be answering questions. We have had some that were submitted previously, but if you do have a question that comes up during the presentation, if you again go down to the bottom of the bar, you'll see a tab marked questions. If you would put your questions in there and not in the chat box, we would appreciate it, and that way we can know how many questions were asked and develop a frequently asked questions document based on questions submitted to the webinar. So please, at the end, once you sign out, you'll be prompted to answer a short 6-question survey. We will need this information to provide our sponsor information on the outcomes of the initiative. And so thank you ahead of time for answering the questions in the survey and helping us meet our goals. Just a disclosure, funding for this initiative was made possible by a grant from SAMHSA, and I'll go in a little more into how PAEA got involved in this grant. But again, what you're going to hear here today does not reflect the policies of the Department of Health and Human Services, and mention of trade names, practices, or organizations does not imply endorsement by the U.S. government. So the PAEA was asked to participate in the Opioid State Targeted Response Technical Assistance Grant Program by the American Academy of Addiction Psychiatrists. And this all got started when our government relations team went over to the Department of Health and Human Services to meet with the newly appointed Assistant Secretary for Substance Abuse and Mental Health, Dr. Eleanor Marcantz-Katz. So they were there describing the role of PAs in medical practices, more specifically about targeting substance use and behavioral health issues. And at the end, the team received a message from Dr. Marcantz-Katz suggesting that they get in touch with the American Academy of Addiction Psychiatry. And so right at about the same time, the announcement for funding for the STRTA grant was just released. And so the the Academy of Addiction Psychiatrists asked PAEA to submit a proposal to become part of a 22-member collaborative, which would form the State Technical Assistance Team for Education and Support. The grant was successful, and PAEA was awarded the funds you see on the screen, which support my activities as well as that of an administrative associate. And so the funding from the STRTA grant goes to pay for the implementation of the initiative through PAEA. So the goals of our initiative are to have 30% of graduates eligible for the waiver at the end of the project period, which is the spring of 2020. Also to have 30% of faculty eligible for the DEA waiver at the end of the project period. And then also to have programs get their students to apply for an NPI prior to graduation. And we'll talk a little bit more about this toward the end. Again, these goals are basically the minimum. The vision of the initiative is to have all graduates eligible for the waiver. They don't have to apply for the waiver, but they should have taken the training and be eligible for the waiver. The same thing with faculty, to have all faculty eligible for the waiver at the end of the period. Assistance and support for PA programs comes through the initiative, and that's my job. And so we've developed a resource page on the PAEA website to help with providing information on waiver training, useful sites regarding research and data on use disorders and treatment, other resources on various topics such as SBIRT and competencies for treatment of use disorders. And we'll go a little bit more into detail in coming slides. We'll also discuss the provider clinical support system, which is another SAMHSA sponsored or supported activity that provides access to waiver training, as well as a number of other activities, videos, and a mentorship program for providers who are treating patients with use disorders. And then we'll talk a little bit more specifically about the STR TA Consortium, of which PAEA is a part. So if you go to the PAEA website, and under the resources tab, about halfway down the menu is MAT waiver training tab. And if you click on that, there's a link to a video and some other things. But at the bottom are these tabs for resources on training, and anytime you click on one of those, it expands and provides various sorts of information for the user. And so under the general information tab, there are links to PCSS and SAMHSA, the Substance Abuse Mental Health Service Administration, the Association, the Academy of the American Society of Addiction Medicine, the Consortium. And then there's also a link to some information on billing for MAT services. The MAT waiver training websites links to the 4 organizations that are designated as sponsors of training. This includes the Society of Addiction Medicine, the Providers Clinical Support System, the Osteopathic Addiction Medicine Academy, and the American Psychiatric Association. Now, under Data 2000, the AMA was designated a sponsor, but they don't provide any training. The NPI link will have, there's a video on how to apply for an NPI, as well as a link to a paper copy of the application for an NPI. Under research and data are links to a number of sites with up-to-date information on opiate use disorder, links to Boston University and the National Institute of Drug Abuse, among others, that provide up-to-date information. So if you are applying for a grant, there are many grants now available to address the opioid use disorder. So if you need information to support your grant proposal, these links can probably help you find relevant information. And then under related resources, there are links to organizations focused on addiction and treatment. So these are provider organizations, advocacy groups. And then under program resources, there are documents that list the objectives for the that are associated with the MAT waiver training, both the ASAM and PCSS, as well as a couple of standardized patient scripts for patients with use disorders, opiate dependency, and chronic pain, and serious mental illness. And these are available for programs that might be doing OSCEs or incorporating standardized patients in their training to use as part of those activities. So again, if you click on one of the tabs, such as related resources, you can find a link to Scope of Pain, which is a REMS activity, a risk evaluation mitigation strategy activity on safe opiate prescribing. This is a 2-hour online program. It's CME accredited. They also do face-to-face training on opiate prescribing and the treatment of chronic pain. There's a video that was produced by the faculty at Baldwin-Wallace University that presents two patients in recovery and one person whose family member suffered OUD, describing their experiences on their path to recovery and the treatments they receive. There are some links to resources for screening, brief intervention, and referral to treatment, as well as links to general competencies for physician assistants developed by the Association for Medical Education and Research in Substance Abuse. These are just a few of the resources that are available. So again, one of the sources of the MAT waiver training is a provider's clinical support system. It's a SAMHSA supported activity that's mainly provided through the American Academy of Addiction Psychiatry. PAEA has a member on their steering committee. But if you go under education and training, you can see a tab for MAT waiver training. There's videos that are available, short videos, webinars, all sorts of information on treating chronic pain and appropriate opioid prescribing. There are lots and lots of resources that are available for programs that you can incorporate into your coursework on addiction and the treatment of chronic pain. So if you click on MAT waiver training, or here's this is just an example of one of the short videos that's available. This is an interview with a patient using heroin. So you can incorporate this into perhaps your behavioral health course or your toxicology course, or even just your general medicine course. If you go to the MAT waiver training, there's a tab for physicians, nurse practitioners, and physician assistants. If you click on the PA link, it'll tell you how to get your waiver, and you don't have to be licensed to take the training. In fact, the Society of Addiction Medicine suggests that anybody who's doing office-based opioid treatment have their staff also do the review the waiver training as part of stigma reduction and for them to understand what's going on. It does say that PAs must have 24 hours of training, the 8 hours, which is the physician training, and then 16 additional hours. So if you click on the link, this is all the registration that's needed to start the training. First name, last name, and email address. They don't collect a lot of information. They don't collect license numbers or anything like that. So it's very easy to register and begin the training. So here's just the first 3 of the 16 hours of additional training that PAs must take. These were developed in association with Harvard University. These are webinar-based presentations. In addition to the discussion about the legal and regulatory aspects of MAT, there are also links. There are also modules on motivational interviewing, expert, treating pregnant women with opioid use disorder, the use of naltrexone, how to utilize urine drug screening, how to treat patients with use disorder and comorbid serious mental illness, chronic pain, and also a module on overdose prevention and treatment. The PCSS training is more slanted toward buprenorphine treatment, and also a big emphasis is on proper patient selection and making sure that the patient that you're going to start on buprenorphine or naltrexone for MAT is appropriate for that treatment. If you go to the Society of Addiction Medicine website, it's very similar. There's a tab for education. If you go to the e-learning center and look for trainings, there'll be a tab that'll take you to the MAT waiver training site. And then if you scroll down a little bit, there's a little box that has a link to waiver training for PAs and nurse practitioners. So if you click on the PA waiver training, AAPA, it'll take you to this page. You'll register, very similar. They don't collect a lot of information, and you don't need to be licensed to take the training. And if you're asked if you're going to apply for a waiver, you can always answer no. There's because you can always do that later on. But again, it talks about the 8-hour physician training, which is a must, and then part 2 is the 16 additional hours that is available. And if you click on content, it'll take you to this page. If you click on the part 2 or the more information, you'll get this page, which basically lists the contents, the titles of all the modules through the 16-hour training. The 8-hour training is basically is there's no real there doesn't really tell you what the content is, but again, it deals mainly with the use of buprenorphine, diagnosis of use disorders, use of drug screening, that sort of stuff. This 16 hours is designated for PAs and nurse practitioners. And so under opioid maintenance detox, you can see that they talk about the ASAM National Practice Guidelines for opioid use disorder, and also for treat special populations for pregnant women. You'll notice that there are short quizzes. These you do, and basically you have to successfully complete each quiz to move on to the next module. So under the patient assessment, it talks about the diagnostic criteria under DSM-5. The clinical use of FDA-approved drugs for MAT talks about pharmacology and toxicology, as well as treatments for other use disorders. The ASAM training is a little broader in scope in that it addresses tobacco, alcohol, as well as opiates and the medications that can be used for the treatment of those disorders. So it talks about nicotine replacement, and as well as things like bupropion and varenicline. And then under alcohol, it'll address not only the diagnosis of alcohol use disorder, but the use of acamprosate, disulfiram, and naltrexone in treatment of alcohol use disorder. So it's a little broader approach to use disorders in general. Again, there's modules on co-occurring serious mental illness, pregnancy, chronic pain. There's also modules on cognitive behavioral therapy and motivational interviewing, as well as a module on 12-step programs. So the STRTA Consortium, again, it's a group of 22 organizations. These are professional organizations such as the American Academy of Family Physicians and others, as well as other advocacy groups and organizations that advocate for treatment of use disorders. And they provide technical assistance in all of the states. And so you can apply, you can ask them for assistance regarding treatment of opiate use disorders. They have identified experts in each state, and if you have a question that can't be addressed by one of the folks in your state, they will find somebody within the consortium that's vetted as an expert to respond to your questions. And while it was originally designed for providers and health systems, as well as other sort of treatment agencies, anybody can ask for assistance. And if you go to the website, there's a form that will allow you to request assistance. And at the last PCSS steering committee meeting, there was a report on the STRTA consortium and their activities, because there's some overlap between PCSS and STRTA, and both of them are grants that were awarded to consortia headed by the AAAP. But it was interesting that among the first requests for assistance they got was from a grandmother who had a grandson with a use disorder and wanted to know how she could help her grandson. So they'll take requests from anybody, and they'll provide assistance to anybody who asks. Lastly, the NPI. Now, all of your graduates are going to have to get an NPI, which is how they're identified on billing forms. And it's not that hard to get an NPI. It takes about 15 minutes. You have to create an account in the Identity and Access Management System. So if you go to the National Plan and Provider Enumeration System, it's nppes.gov, I believe is the website. If you don't already have an account, you can create an account, and then you can use your newly created login and password to log into the NPPS site. Now, if you have an IAMS account, your NPPS forms will be, your NPI forms will be automatically populated with your information. And it's done online. There's about 7 steps. It's very simple. They want demographics such as your name and things, some of which is publicly available. Remember, NPIs are publicly available information. You can search for anybody's NPI number, or search for them if you have an NPI number. And so name and address, they want an address for a practice, a mailing address, they want an address for practice. Again, because these are students, they can put in a good address because they may be contacted by mail, and forms may need to be sent to them. So they need to have an address where mail is checked on a regular basis. They'll have to pick a taxonomy code. Those of you who are practicing, know about picking a taxonomy code for PAs, either medical or surgical. At the bottom of the drop-down menu, way at the bottom, is healthcare student. And if they just click on that, it'll populate that box with a healthcare student taxonomy code. There's some attestation pages, but it's very simple. And then they'll get an email that says, here's your NPI number. And what we're asking is that when your students get their NPI numbers, if you could just keep those in a file. It's going to be helpful for you, since you know that once your students graduate, it's very hard to keep track of them if they move out of state or change jobs in the first few years. And so with their NPI number, you can at least find out where they're working and get an address, a contact address, and also will help you keep track of where your graduates are practicing. So if they're working in a hospital, or if they're working in a private practice, or what sort of practice. So this can give you good information for outcomes for accreditation, as well as grants or other projects that you have going on. So we're asking that everybody have their students do the NPI number for that. So while we're waiting for folks to put their questions into the question box. This was a question that was submitted prior. The charge is to do the waiver training modules that are provided either through the Society of Addiction Medicine or PCSS. In order to qualify for the waiver, you have to submit to the Substance Abuse Mental Health Service Administration a notice of intent to apply for the waiver from the DEA. So you submit this notice of intent along with proof that you took approved training. So the certificate that you get when you're done with the waiver training, and you'll actually get two, one for the 8 hours, one for the 16 hours. So you submit this information with your notice of intent. SAMHSA will verify it, and then they will send that to the DEA, and then the DEA will send you your new certificate. So the Data 2000 law, as well as CARA 2016, specify that the training has to be provided by these designated sponsoring organizations. And so the waiver training modules are available online. They're free, and whether you incorporate them as part of coursework in the didactic year or have your students do this during their clinical year, it depends on program requirements and opportunities. But I would think that if you wanted to go through all the work of developing these 24 hours of training, you might be able to submit them to an organization like ASAM and see if they would approve the content for you. But the material is already available. It's free. And if you go back to, I forgot to mention, both ASAM and PCSS do face-to-face training for the 8-hour physician waiver training. And so there's a calendar of events that lists where these trainings are going to be provided. And you might check and see if there's going to be a face-to-face training nearby that your students could partake of. So I don't see any questions. Oh, here's a question. There's a question from Sarah Latchford. Describe the 8-hour training, and all of the 16 hours is online via webinar. Again, the 8-hour physician training has modules on the physiology of addiction, pharmacology of the opiate agonists and antagonists that are approved for the treatment of use disorders, a module on urine drug testing, a module on the diagnosis of use disorders, and then a module on how to incorporate office-based opioid treatment into your practice. And so that makes up the bulk of the 8 hours of physician training. As I mentioned earlier, the 16 hours has a more broad range of information regarding the use of screening, brief intervention, referral to treatment, the use of MAT in patients with co-occurring serious mental illness, pregnancy, and again, ASAM has a broader approach to use disorders in general. Next question is about the number of hours of Category 1 CME. The training is approved through AAPA for a total of 24 hours of Category 1 CME, 8 hours for the physician training and 16 hours for the NPPA training. I'm not an expert on CME, but I'm not sure. Your students might be able to claim credits through NCCPA after they graduate. But I'm not an expert on those rules. There's another question from Carla Shambian. Are we able to request that an STRTA consortium physician come to campus to provide the required 8-hour face-to-face training? I'm not sure. That's a good question. It might be something that you can ask. The other options would be to check with your local chapter of the Society of Addiction Medicine. They put these trainings on a regular basis, oftentimes in health systems or in association with state medical meetings. So that would be the place to start to try to find somebody qualified to do the training. But I don't know that it would hurt to contact the consortium and ask. Next question is from Marie Meckel. Do students have to pay the $700 to the DEA when you apply for this waiver? I don't believe I've ever seen that there's a cost associated with the waiver. You have to pay $700 to get your initial DEA certificate. But I've not ever seen anything that says that there's a cost associated with getting the second DEA number for prescribing buprenorphine for MAT. A question from Jennifer Coombs. Is there any advantage in having students do MAT training near to the end of their training time late in the clinical year? I think it depends on on how your program is configured. At Central Michigan University here, our students are taking the waiver training during their clinical year. The first 6 months of the year, they'll have to finish the training. So they have 6 months to do the training. It's 24 hours online, so it's not a big burden. It's something they might be able to do during the Christmas break or something like that. And we just had our first callback, and I know that there are already a couple of students who are have pretty much done the training because they started doing it during their break between summer and the fall semester. So some of it it might be helpful to have them take the training later after they've had didactic courses on pharmacology and behavioral health and those sorts of things, so that they might have a better understanding for the material presented in the waiver training. And then at the same time, it might give them an opportunity to start apply some of the information they get from the modules into their clinical training experiences. So a lot of it just depends. I know I've heard from a couple of programs that are incorporating part of the training during the didactic year in their behavioral health course or their pharmacology course, and then having the students finish up the rest of the training during the clinical year. So a lot of it just depends on how your program is configured. Another question from Sarah Latchford, is the 8 hours online as well? When will this webinar be able to be listened to again? Yes, 8 hours is available online as well. So the whole 24 hours can be taken online. It's available for free online. And I would imagine that the webinar will be posted and archived within a few days. But I would wait, and I'm sure we'll be messaging everybody as to the availability of the archived webinar. Another question from Dave Cahey. When is the best time to work this into the curriculum, didactic or clinical year? I addressed a little bit of this in the answer to Jennifer Coombs, but again, it depends on how your curriculum is structured. As I said, there are programs that are looking to incorporate the 8-hour training sometime during a didactic year. and as part of either a behavioral health course or a pharmacology course or something like that. And then having the students finish the 16 hours at a later time. At Central Michigan University, we're having the students do all the training during their clinical year. Again, because they've completed all the didactics, we're hopeful that they will then be able to assimilate the information better, and then again be able to start applying some of the material such as SBIRT and motivational interviewing during their clinical training experience. The next question from Lindsay Fox. At Central Michigan University, you reported they complete all their MAT training in the clinical year. Is that your only requirement for them? Do you have any in-person OSCE shadowing with an experience provided to learn how to prescribe safely by example or participation in any mentorship? As far as the MAT training, yes, we're asking them to complete all the training in their clinical year. I am in the process of working with our clinical education coordinator and the director of clinical education about incorporating a scenario regarding either appropriate opioid prescribing or somebody with a use disorder into the summative OSCEs at the end of the clinical year. Now, one thing I didn't mention is that SAMHSA just awarded a number of grants to institutions called the PCSS Universities Grant. And we were fortunate here at Central to be one of the awardees. And there were, among the 24 awardees, there were 12 institutions that had PA programs. And a number of those programs are participating in this grant, which will pay for the face-to-face 8-hour training. The grant, the PCS Universities grant does require a practical experience component. So our students will be participating in an experiential component. Now, having discussed this with a number of our recent graduates, they have, some of our students did rotate through practices where office-based opioid treatment was being provided. And so they did get some experience that way. But those practices are pretty much few and far between. Next question from Brenda Diaz. Does the MAT waiver certificate expire? As far as I know, it doesn't. Once you get the number, then it probably expires at the same time your regular DEA waiver does, and so you probably just have to make application to have it renewed. But I'm not sure if it does. But the waiver training doesn't expire. So once you've done the training and you get the waiver, then it's just I would imagine just a normal routine renewal process for the DEA waiver. The DEA buprenorphine number. Then another question from Sarah Latchford. When you mentioned the scope of pain from Boston University, was that just mentioned as an add-on to introducing this concept to the program or something extra? When the FDA became aware of the over-prescribing of long-acting opiate medications, they developed something called a risk evaluation and mitigation strategy. And so this is a requirement that all prescribers have to get this training. The training is paid for by basically a fee on the pharmacy companies that produce these long extended release opiates. And so Boston University got funding from the FDA to develop the scope of pain. The scope is an acronym for opiate prescribing. I don't remember the exact acronym, but it basically talks about how to identify patients at risk of misuse or abuse of opiates, and the appropriate prescribing of long-acting or extended release opiates. And so this might be something that you would incorporate into maybe a pharmacology course. We incorporated scope of pain training into our clinical orientation course. So I presented the training. You can, all of the materials available from the Scope of Pain website regarding the training. There are online trainings, there's face-to-face trainings. You can download the whole curriculum if you like. So again, this was just something we added into the clinical year orientation. Okay, any other questions? Doesn't look like there's any other questions. So as I said, I would expect that in a few days, you should receive a notice that the archive recording is available with a link to the recording for you to look at or have any of your faculty take a look at or your colleagues take a look at. So if there aren't any other questions, we'll go ahead and close out the webinar and let you get back to your work. So thank you all for attending. And again, if there are any questions, don't hesitate to contact me through the PAEA, and I'll be happy to answer those questions as they come up. So thank you very much, and enjoy the rest of your day.